Breathe in. We do it every day, every moment, every minute. It's natural. It's what we do. But what happens when you are out of your breath? Do you remember the feeling when you were running or biking or doing whatever you want and you were just, I can't catch my breath? You are not nodding, so maybe let's try to practice one more time. I will ask you to hold your breath for 1 minute with me. Are you ready? Yes. Okay, so on my count, 3, 2, 1, and go. If you will run out of your breath, please put your hand up. I'm just curious. Okay, the first one. Second. Okay. 30 seconds to go. Okay. Another 20. It's not that easy, right? Five, 4, 3, 2, 1. Did someone manage actually? Good for you guys, good for your lungs. So, let me know how it feels, because you had it in this very moment. But imagine that this feeling, being out of breath, is part of your everyday life. Imagine being out of breath with this anxiety, this stress, this feeling that you cannot catch your breath 24 hours a day, 7 days per week. And this is the reality of our patients. Our patients in end-stage pulmonary diseases, they are bound to the oxygen machines. They're unable to sport, they are sometimes unable to walk, and breathing is the most important thing they have to concentrate about every second of their life. Can you imagine living like that? I wouldn't, and I'm very happy that I can't, but it's a part of everyday reality for the majority of our patients. What can you do? Can you give them new lungs? Actually, you can. That's why I'm here, because I would like to talk with you about the lung transplantation. Lung transplantation is a life-saving method for the patients who are in end-stage disease. And their lungs are not working. It's a method for well-selected patients. And if you imagine it, it's quite easy. You open the chest, get the lungs out, get the new pair in. It's like piping, putting tubes together. And first time it was performed in 1963 by James Hardy. But it took more than 25 years to get this method into clinical practice. And why? Lungs are complex. Imagine it's a system which is in constant communication with outer environment. So there are a lot of immune cells that are fighting, they are helping us not to get sick, not to get ill every day. But in terms of transplantation, these immune cells know that the lungs are not yours, and they fight with your lungs. So one of the most challenging things in lung transplantation is that you need to balance the level of immunosuppression, meaning how low you might suppress the immunity of your patients and the risk of infections. That's the reason why lung transplantation, despite being technically possible, tubes were not performed for many, many years. And in fact, they started to be part of the routine medicine in the 1990s. The first transplantation in our center was performed in 1997. And since that time, we saved quite a long line of people. Last year, namely, we managed to save 67 patients. And can you imagine how it is from going from the feeling that you cannot catch your breath to having a life where you can actually live? I have a patient in my outpatient follow-up who's training for marathon after lung transplantation. Another of our patients is able to cycle 80 kilometers per day. Few of our younger patients got married, started families. They can actually go to school. They can go to work. We put them back to life. On the other hand, there is the burden of transplantation, because I don't want to lie to you to tell you that this is the perfect method and we can save everyone and everything is picture perfect and it's just pinkish. There are a lot of our patients who have complications, who stay a lot of time in hospital. And they are the patients we actually create bonds with. Because imagine if I've seen some familiar faces from here, some part of you are med students or doctors. If you are a doctor treating regular patients, they are just switching. Imagine that you have a cohort of patients, like 200, 300 people you actually know. So they start to be more people you know about their friends, about their families, about their dogs, cats, and there are less patient number 1, 2, 3. And sometimes this creates a very specific bond. And sometimes, if you help those patients in this critical moment, they start to call you, oh, you're my guardian, you're my angel, you saved my life. And this is one of the nicest things that can happen to you. But on the other hand, this is one of the most challenging things that can happen to you in your clinical practice. Because if you are put into this position, it's very difficult not to start to believe that they are right. Because the theme of this TEDx is what matters. And I asked myself the very same question, what matters? Why I do this job? Why I opted lung transplantation? Okay, to be honest, it's nice. Yeah, if you put the sick lungs out, you put new lungs in, it's a very nice thing to have a look at. For me, it was the most beautiful thing I have seen during my med school, and maybe that's why I got stuck with this. But on the other hand, we need to be sincere. And I cannot talk about my colleagues, I can talk just for myself, but doing a medicine which is considered to be one of the top fields in what I do in pulmonology. It's not just because I find the lungs beautiful, or not just because I want to help people, because of course we do, of course it's beautiful. But we have to be honest with ourselves about the motivation why we do this job. And for me, one of the motivations why I do lung transplantation is that I like to be intellectually challenged. It is a very nice thing about this job, because if you are doing lung transplantation, you always need to read new publications every day, new guidelines every day. If you want to be only on the top of the field, which is on top of the track, you really need to work hard. Meaning, for surgeons, sleepless nights. For anesthesiologists, the same. For me, as for pulmonologist and researcher, lots of nights with computer. A lot of black circles under the eyes, so thank God for correctors. But I think it's very important to be sincere with yourself about the motivation that you have for your job. Because yes, it's nice. If you manage to save someone's life, it's nice. But on the other hand, we are not the angels. And glorification of the healthcare workers has been part of our culture. But the lesson we have to, at least I had to learn, is that we are just people. We are trying to do our jobs the best we can. We are trying to provide the best possible care for a very narrow group of patients. Because last year we did 67 transplantation for Czech and Slovak Republic, meaning 15 million of people. So despite we are doing top medicine, our efforts affect just 67 of the patients. And I mean, for your future clinical life, very important thing is to balance. To balance your confidence. Because if you are taking care of the patient, you should be confident enough not to be afraid to take decision how to proceed. But on the other hand, you should be with your feet on the ground, understanding that you're a person, you're making mistakes, you're not a guardian, you're not an angel, you're just a clinician. And this is something you have to keep in mind that you are taking care of your patients. On the other hand, yeah, just 67 patients, but in the numbers, this is the number of years we have given our patients from the start of our transplant program. We have gifted 2,830 years of life to our patient, which, if you imagine, it's amazing. I mean, almost 3 millennia. This is why we do the job, why we keep pushing forward. Nice, right? But on the other hand, we need to keep in mind that the median survival after lung transplantation is just 7 years. Okay, it's extra 7 years for our patients, but in comparison to other solid organ transplant, it's just 7 years. And that's why lung transplantation is so challenging and so nice field to do, because the research, the clinical knowledge is emerging very, very rapidly. And if you would like to be involved in this really amazing field, there is lots of fun you might have with clinical trials, with doing research, with doing animal models. And that's it, because if you will try to comprehend what matters in transplantation, or what matters in general when you are doing a medicine, at least from my point of view, is that you should be able to balance. In terms of lung transplantation, you should be able to balance rejections, meaning immune problems, with infections. In terms of your professional life, you should be able to balance your confidence with overconfidence, because the most important thing we have to think about is the patient. But to end it in a more positive way, I will repeat the number once again: 2,830. The number of years we have gifted our patients. We have gifted them possibility to what? To work, to study, to run marathons, to win tennis tournaments. And I think this is what actually matters. Thank you.